Hi, this is Lindsay Tyler, and I'll be examining the Picture This project. The case study that we'll be examining today uses photo voice as a central method for compiling a community health needs assessment. So I think it's important to explore what photo voice is. It's when a community people take pictures of their lives, targeting their everyday realities around a specific social issue to catalyze group discussion and action. So the case study we'll be examining is specifically around maternal and child health issues. And photo voice participants work to change the way their public presence is defined. The basis of this article is exploring photo voice as a community assessment. And they identified that photo voice can help participants define the issues in a community and the most relevant social actions for tackling those issues. It's accessible to everyone, whether they can read or write, so that really expands the marginalized population that you can include in this type of brainstorming for a needs assessment. It can sustain participation of the community between needs assessments and program planning. So there's usually a gap between compiling a list of community needs and developing and implementing program interventions in the community. So photo voice is a way to keep the community engaged even in the lulls of this type of programming. And it provides a way to reaffirm or redefine program goals during the assessment process. So if upfront the researchers identify A as being an issue, but through photo voice, the community identifies topic B as the issue they're concerned with, it might be an opportunity for the researchers in the community to collaborate and redefine the program goals that were originally set up before engaging the community in that process. And I'd just like to recap some of the CBPR principles. I'm not going to read them all because I'm sure you're all very aware of them, but I did highlight some of the ones that I thought that this case study using photo voice really touched on. So that would be CBPR is recognizing community as a unit of identity, CBPR building on strengths and resources within the community, promoting co-learning and capacity building among all partners to address social inequalities, integrating knowledge and intervention for mutual benefit of all partners, and emphasizing public health problems from both a positive and ecologic perspective. So although I think an argument can be made that photo voice, as used in this case study, touched upon each of those principles, I think the ones I highlighted were really strong and obvious right up front when reading the article. Some of the reasons that I definitely think photo voice is a method of community-based participatory research is that community participation is inherent in this method. You can't do photo voice without engaging the community. Otherwise, it's not photo voice, it's just people taking pictures. It's used to establish community priorities for interventions. So it's not just imposing priorities on a community, it's engaging the communities in developing those types of priorities. And it doesn't only focus on community challenges, but it also highlights the assets in a community as well. For example, in this case study, participants identified a photo of a park that had hypodermic needles lying around, trash everywhere, graffiti. It didn't look like a safe place for community children. And then they contrasted that with a park in the community that was the opposite. Very clean, family friendly, no obvious dangers laying around on the ground like needles, drugs, anything like that. So it's just a way to show that within one community, there are going to be problem areas, but it's also a way to highlight the areas that we hope to achieve across the entire community. And it establishes ongoing engagement and buy-in from community members to galvanize action. So after they had their focus groups around the various photos taken by community members, it was noted that many of the community members ended up taking photos of the same park that we were just discussing, this really gross, dirty, unsafe park. And so the community members, who all noted this as an issue area, took it upon themselves to create a task force to go in and clean up the litter and scrub off the graffiti and clean the park up to higher standards of the other park that we were describing earlier. And this wasn't with the help of the health department at all. The community members saw the issue and saw the outcome they wanted to achieve and made it happen in a short period of time on their own. So now I'd like to dive into the specifics of the case study that I keep referencing. So it was the maternal and child health departments are required to conduct a needs assessment every 5 years in the county that they're located. And needs assessments are used to draw up the health department's 5-year plan. And they're also used to identify areas of need to apply for federal funding. Traditionally, needs assessments focus on quantitative outcomes and don't include qualitative firsthand accounts of residences. So incorporating photo voice allows the health departments to supplement their quantitative data with these firsthand accounts of community perspectives. I'd like to set up some context around the community that we'll be discussing. Contra Costa County has the poorest perinatal outcomes in California, which includes cities Richmond, Bay Point, and Pittsburgh. Those cities encompass a region of 5 different zip codes that we'll specifically be targeting in this intervention. Rates of teen births are 57.6 and 56.8 compared to the national average of 23.8 births per 1,000 teens. So I think that gives a little snapshot of the type of community that the public health department is targeting. It's double the national rate. So that's quite a shocking statistic. It's not a surprise why they're targeting that region. And these cities were the focus of the Photo Voice project to gather qualitative data about family, maternal, and child health concerns of the community residents. So when we talk about the community, we're specifically talking about those 3 cities within Contra Costa County. So the methods for participant recruitment included the creation of flyers that explained the project and the type of participation opportunities that would be available to residents. And those were distributed throughout the 3 cities. They were distributed by public health nurses and community outreach workers, handing out the flyers at clinics, community centers, child care centers, battered women's shelters, preschools, laundromats, and local WIC departments. So it's a clear target for marginalized individuals that can be found specifically around maternal and child health. And it was noted that participants would receive either a cash stipend or a gift certificate to local supermarkets with incentives averaging $75. The sample of individuals collected included 60 different people, and I should note that this wasn't a random sample. They actually had health department staff choose or hand select the 60 individuals from those that may have applied or showed interest. and the article didn't go into detail as to how those individuals were selected. But nevertheless, they were 13 to 50 years old, 50% were African American, 40% were Caucasian, and 10% were Hispanic. And they didn't identify if that sample was representative of the county's more general demographic. So I can't speak to that either. But they did say that most of the individuals selected came from the 3 cities we were mentioning before. So to begin engagement with the participants, there were 2 3-hour workshops that were held over 5 months to prepare participants for the actual photography portion. And those workshops were held on different sides of the cities to eliminate transportation barriers for participants. And in those workshops, they covered basic photography skills, the ethics of taking photos, how do you approach people in a community to take photos of them, what you should, what you shouldn't take photos of. And they also touched on risk mitigation, so how to minimize risk, be it a physical danger or a loss of privacy to themselves or the community when taking photos. They definitely emphasized no amount of harm to the individual taking photos is worth getting that photo. So each participant received a disposable camera and a stamped envelope addressed to the health department. And they were asked to mail in cameras by a certain date. And once they received those mail-in cameras, the health department printed 2 sets of photos, one for the participants and one for themselves. So once they received all of those back, they held subsequent workshops where they divided participants into groups to discuss the photos that they had printed. And they did this using the SHOWed method, which incorporates facilitation around these 5 questions. What do you see here? What's really happening here? How does this relate to our lives? Why does this problem, concern, or strength exist? What can we do about it? Not only did they have a verbal facilitated discussion around these questions, each person was given a photograph and they had a free write portion. So people were able to write up messages about other people's photographs relating to these 5 questions. So the outcomes captured in this case study were pretty telling. It was noted that interventions by the health department focused on improving the rate of entry into prenatal care, and improving the care's quality, reducing low birth weights, and infant mortality, reducing family and domestic violence, preventing teen pregnancies, and addressing issues of tobacco and substance abuse during pregnancy. So the interventions from the health department, as you would expect, were around the clinical care of pregnant mothers. And when they did the photo voice, the overwhelming majority of residents of all ages said that their principal concerns were safe recreation for children and improved living conditions in the neighborhood. So all centered around the built environment, which is pretty different than what the health department had been previously focusing on. So that was a pretty interesting finding. So once that data was collected, the next step for the health department to use the data was that the photographs and stories gathered through the Picture This project supplemented quantitative data used by the health department to determine MCH objectives for the 5-year work plan. And the project galvanized community action towards addressing some MCH goals and outreach. The article identified various strengths and weaknesses for using photo voice as a CBPR approach for community health needs assessment. Some of the items they identified was that photo voice served as a way of gaining community input from people directly affected by MCH program, system, and policies, and it provided a new way to tap into the creativity of the community people from various cultural subgroups, regardless of their formal education. As I previously mentioned, this allowed them to include marginalized citizens that couldn't read or write, or probably wouldn't have had an opportunity to tell their story in any other way other than through photos or direct conversations with the health department. It gave MCH staff a chance to complement or enhance quantitative assessment data with grassroots visual and narrative material. And unlike surveys or interviews, it didn't limit individuals' responses because it was an open-ended type of method. The health department staff reported feeling invigorated by their new understanding of community issues as defined by the people they serve. So probably in reference to my last slide, when they found out that the interventions they had been implementing up until that point hadn't really aligned with what the community's identified needs were. And it may enhance MCH staff's ability as advocates by equipping them with narrative-driven policy and program recommendations. And it served to foster a sense of community among participants. Concerns about local issues transcended generational, neighborhood, and ethnic differences. As I previously mentioned, once they did the focus groups and brought everyone's photos together, they realized many people from all different areas were taking photos of sometimes the exact same trash heap on the sidewalk or the exact same park. MCH staff found the methodology an ideal way to identify a variety of citizens willing to volunteer time, energy, and insights to furthering these initiatives. I guess approximately 2/3 of the participants turned in information sheets asking to be contacted to collaborate on future MCH programs. That's a pretty good turnout. That statistic actually really surprised me. Some of the weaknesses that were identified were that those who control or contribute to the public presentations of participants' photographs and stories can influence the ways they'll be used because the images are subjective and open to interpretation. There's one thing that I do have to say about that point is I think if this were a thorough A+ CBPR method, they would actually involve the community members in the public presentations themselves, just because everyone knows that you can't tell someone else's story for them, and engaging them in the presentations to whether it be funders or policymakers or community leaders, engaging the people that live those stories is probably the best way so you don't have to interpret what they meant. So I think that can be overcome in other circumstances and turned into a positive, but in this article they mentioned it as a weakness. And policymaking is slow and uses a lot of data, so this makes it somewhat difficult to demonstrate just how much a photo voice project has helped to improve a program or policy in a defined period of time. Like volunteers for clinical trials, photo voice participants may not be representative of their broader cohort. 1.5 million residents were found in that county, and they only had 60 people selected for 5 whole zip code regions. Sample sizes might be too small for pre and post workshop surveys to lend themselves to statistical analyses, and it might be challenging due to resources and follow-up with participants who had self-identified as willing and available to assist county staff in planning and developing MCH programs and priorities. I guess the following up with people who said they wanted continued engagement was difficult for a small staff. The article noted some lessons learned, and I also threw some of my own in there. Community members' perspectives may be unlike those held by experts or the researchers, and everything we've learned thus far points to this being so painfully obvious, but it was really good that this article pointed out yet again that if you want to know the community's perspectives, you have to ask the community. Community leaders should be recruited at the project's outset in order to promote a political climate receptive to photo voice participants' potential policy and program recommendations. So if you want to smooth over the presentation portion or the lobbying for funding of community leaders, it's probably best if they're engaged right from the beginning. And established the possibility of long-term relationships, allowing for future photographers and exchanges of knowledge, as well as the possibility of requiring written consent to use photographs for health promotion aims. It also can be used to broaden outsiders' views as it supplements traditional epidemiological data. So instead of looking at Detroit, Michigan and saying, oh, their birth outcomes are poor, all of their emergency department admissions are from drug abuse or misuse, look at all of these rundown buildings, housing instabilities, problem in Detroit. Photo Voice gave the participants an opportunity to highlight the positive assets that might not come across in traditional data. It's important to remember that communities are more than the numbers that might represent them. And my final thoughts on this article was it did a great job of showing how Photo Voice can be a powerful tool to engage community members. But the article specifically used Photo Voice as a means to collect data for a community health needs assessment to identify the needs, but it didn't go into detail about, once the needs were identified, if interventions were created to address those needs, how the people in the community were involved in the intervention implementation, if lessons learned after those implementations were shared back to the community. It really stopped at gathering information for the needs assessment. So it's hard for me to visualize whether or not the community was kind of dropped off after that front heavy, approach to the needs assessment, or if they were continually engaged in all of the follow-up that would have been an outcome identified in the needs assessment. So I was hoping it was going to go into more detail around that, but it didn't. And here are the sources and citations for some of the photos and articles that I used, in addition to the one referenced at the beginning of the article or presentation. That's all I have. Thank you.